What is a fracture? What is a sprain? And honestly, what is the difference?
Let's look at it this way. A fracture or a broken bone is one and the same thing. You take the bone, something happens to it and it turns into multiple pieces.
Anyone suspected of having a fracture will exhibit the following signs and symptoms. Number 1, an out of place or misshapen, short, twisted or bent limb or joint. Number 2, swelling, bruising or bleeding. 3, intense pain. 4, numbness and tingling. 5, broken skin with bone protruding. That's an open fracture. 6, grating noise or feeling in the limb. 7, limited mobility or inability to move a limb. 8, loss of strength. 9, signs of shock.
So what do you do in such a situation? What's the first aid treatment for a fracture? 1. Maintain the patient still and composed to prevent unnecessary movement rising from the anxiety or fear. Pad and support the injured area with padding such as towel and cushions. Immobilize the bone with a splint or string both above and below the injured bone. Secure it with a sling or triangular bandage to stabilize the arm. In the case of an open fracture, cover the wounds and apply gentle pressure with a sterile bandage or clean cloth to stop the bleeding. Call an ambulance if you are unable to transport the casualty to hospital. Be prepared to treat for shock.
Now, if you're squeamish about some of these things like blood and broken bones, call the nearest person who can help you or guide someone near you on how to do this procedure.
Now moving on to sprains. To best explain a sprain, let's take an example of a bed whose support is made of springs. When a heavy strain is put on the springs, they overstretch and sometimes break. These sprains represent the tendons and ligaments that support the bone. When stress is put on these ligaments, for example when you twist your ankle, they get stretched and sometimes end up getting torn. A sprain.
Someone suspected of having a sprain will exhibit the following signs and symptoms: swelling, some bruising stroke skin discoloration, joint or muscle pain and stiffness, instability especially when trying to put weight on the joint, and inability to move and use the joint.
In this situation, what's the first aid treatment for a sprain? 1. Raise and support the injury on cushions. 2. Apply ice right away to reduce the swelling and cover with padding. 3. Apply a roller bandage to hold the ice pack and padding in place. Make sure the bandage covers from the joint before to the joint after the injury. 4. Check circulation every 10 minutes to make sure the bandage is not on too tight and restricting blood flow to the injured area. You can do this, for example, by pressing on the tool for 5 seconds and the color should come right back when you let go. 5. Keep the injury elevated. 6. Get the casualty to hospital. 7. Aspirin or other pain relievers can help. However, do not give aspirin to children.
You got all that, honey?
3 oinkers wearing pants, plate of hot air, basket of grandma's breakfast, and change the bowl to a gill. Got it.
And that covers fractures and sprains, from how to differentiate the two to the first aid treatment.
Therefore, I hope this video has been useful to you. So seme siku wa bia, you are never taught in school, I don't know first aid, ama nyaje.